Hey, welcome to Hill Center of Integrative Medicine. We're thankful you're here today. Today I want to talk about a topic that we treat primarily here in the office. In fact, here's the statistics say. Over 80 million people in the United States suffer from this particular condition. I mean, that's most of us at some time. They say statistically that most everyone will at one time or another over the course of the year be presented with this particular issue, and it's called low back pain. It's an epidemic. It's everywhere. People will suffer with it, and perhaps you are even today suffering with the condition of low back pain. I'd like to talk just a little bit about low back pain, the causes of low back pain, and then second of all, some things that we do here in the office and the importance of seeking care to make sure that that low back pain doesn't turn into something more serious. Now, first of all, low back pain is caused from many things. If I were to line up 10 patients that come into our office and I ask them, hey, how'd you hurt yourself? 9 out of 10, 8 out of 10 will say this very simple thing. You know, all I was doing was bending over and twisting. I just twisted a little bit and then, I got that really sharp lower back pain. So it's not necessarily an activity that is created from heavy lifting necessarily. It's about the mechanics that the person was in when they injured themselves. Primarily, it's a bending forward and twisting motion that created that injury. So when we look, I just have a model here and we'll take a look at this. When we look at the spine, here's a look at the spine, and basically what we're looking at here, this is the vertebra, then we have the disc and the vertebra, and then in the back, if I turn here, this is the joint right back in here. And those are the three areas. I use my pen and you might see it a little bit better. These are the three areas where most of the discomfort takes place. It takes place back here at the joint surface right there. It'll take place because the disc has become swollen and irritated, and that will pinch and irritate the nerve. And some of the symptoms obviously is just acute low back pain in the back itself. If the nerve is very irritated, it will produce pain down the leg. We hear about that. It's called sciatic pain. That's what everybody says, I have sciatica, or I think it's my sciatic nerve, and it may or may not be that. It can be affecting several different nerves in the lower back, but the nerve is being irritated, and now it's presenting not as lower back pain, but as leg pain itself. And that could be a lot more serious, especially when someone comes into our offices saying that their leg hurts more than the lower back pain. That way, we're pretty much assured that the disc is irritated and the nerve is being pinched. So those are some of the causes of low back pain. What do we do about it? Let's talk about first what you should do if you do experience acute I hurt low back pain. You want to use ice first. People ask, should I use heat or ice? Oftentimes people have come in, they've been sitting on a heating pad for a couple of days, and that really helps the muscles feel better, but it's actually created more issues because it's created more swelling in the joint, and that creates a lot more discomfort. So ice is the first choice there, especially for that sharp stabbing low back pain. And then of course you want to get into our offices as soon as you can. And here's what will happen when you come in that'll be important. We're going to sit down with you. We're going to talk to you and listen to you about exactly what's happened. We're going to do a complete orthopedic and neurological exam. If we do a more extensive medical exam, we'll do that as well. We'll take x-ray studies depending upon what areas we need to evaluate very closely. If you have any already existing studies like MRIs, CTs, make sure you bring those in and we'll review those with you as well. And then we'll sit down with you and we'll tell you what's wrong and why it's wrong and develop a complete plan. What do we do here special at Hill Center that might be not happening at other clinics? We have the advantage of the more advanced therapies that we can do. Not only do we do chiropractic care, and we do several different techniques, and you can check our video out talking about specifics about chiropractic care, but we also have a complete therapy department, so we can do electrical muscle stimulation, we can do traction, ice, heat, and do some of the more advanced therapies there, as well as massage. And then we can use hyperbaric chamber treatment. Make sure you check that video out, talking about the healing of the tissues, just to advance the healing process there. So that's a little bit about low back pain. Make sure that you do this. Make sure that you subscribe and like us. Make sure that you check out our website, check it out. Make sure that you can look at our videos there. We have specials going on all the time. Make sure you do that. And then in the comment section below, if you have any questions, make sure you comment there and we'll get in contact with you. But again, that gives you a little piece about what's happening and the seriousness of low back pain. So give us a call. And thanks for stopping at Hill Center.